So, welcome to today's webinar. And I think this is one of this topic we are going to talk today about is about potency. I like to call it as the potency problem. It's more of a problem than anything else because it's a matter of such a great controversy, interest for all the homeopath, especially students. And you see every other homeopath having another philosophy about potency, and everyone having their own views. So I thought I'd put across some of my ideas how I do it. There's a joke that I often say that in any lecture, in any conference, anywhere I go to teach, whether in India or abroad, there has to be, after a case, someone puts his hand up and asks me, "Sir, the remedy is okay, but what potency did you choose and why?" And it amuses me because the amount of efforts I put into finding the remedy, and it's quite tough. And the question is always about potency, jokes apart. So, it's very important to know that different people and different homeopaths all across the globe have different ideas about potency. We have in India a homeopathic hospital by Dr. Amar Singh Hanikam, and he uses only 30 potency. Interesting. We had our old homeopaths, Lippi, for example. He used to give very high potency, 50 m, 45 m. Kent used to give very high potency, 10 m, 50 m. Kanjilal used to give very high potencies. Doctors from Kolkata, Banerjee, Sarkar, they give very low potency, 6, sometimes mother tincture, 30. Now, what is right? Because everyone has results. And this is where I'm putting across because I've learned from everyone. You can say हमने हर घाट का पानी पिया है. So understanding everyone, I've tried to make a little bit of a leverage, a kind of a basic idea as to when to use which potency. So let's try to understand that. We'll start with high potency. When do I use high potency? When do I use 10 m, 50 m? It's very simple what I'm telling you. When there are very, very strong mind symptoms, very strong. For example, if someone is very, very destructive, very, very angry, throws things, feels very, very sensitive, where there is a very typical mind symptom of staph aureus. Anger throws things, for example. And that is very strong in that case. Then I will give high potency, maybe 1 m, maybe 10 m. There is a strong craving for oranges, craving for bananas, Theridion. I would look at high potency. Or in cases where there is a very strong exciting factor, history of repeated death, and then the symptoms develop. Ambra grigia, I will give high potency, 1 m, 10 m. So high potency, either it is 1 m, 10 m, I have even given 50 m and cm, depending on the case, would often have lesser repetitions. And mainly in this type of cases, there will be more functional symptoms, enzymatic changes, and not very major structural changes. 1 m also I use very often, like I told you. Now we talk about another potency which I like to call as the moderate potency, or in homeopathy I like to call it as the safe potency. 200 is often a safe potency. When confused, use safe potency. What is a moderate or a safe potency? 200. In cases where there are many symptoms, there is an emotional component, or there is very strong physical characteristic, but there are only 2 or 3 symptoms not very clear, I often use moderate potency. Wait and watch policy. 200 potency, wait and watch in 2 weeks, 3 weeks, then evaluate. Now we come to low potency, whether it is 30 potency, 6 potency, mother tincture. What is my idea about it? I'll tell you. Cases where there are very few symptoms or no characteristic symptom. Patient come with sleeplessness only, nothing, no other symptom. Then you could think about remedy like passiflora in mother tincture, or you could think about other remedies. One of the remedy I use is Pisidia. That's a remedy I use for sleeplessness in mother tincture. Patient comes only with gallstone, no other symptoms. You can think about cholesterol. Low potency. So only pathology with low vitality you can give low potency. Even sometimes potency like 3 or 1x I've used. Mother tincture also. But I also want to tell you that I don't stick to only these ideas. Like I had a case, very high blood sugar. It had HbA1c was 10. I was treating. and he didn't want to take allopathy. And there were no symptoms. I gave him Gymnema sylvestre, mother tincture, twice a day. Within 3 months, the blood sugar came from 10 to 7, only on homeopathy. So I also use mother tinctures also, and I use high potency also, 10 m, 15. So I decide the potency depending on the type of approach and type of cases. Some remedies work better in low potency, especially the organ remedies, Indian remedies. While certain medicine which you prescribe on a higher mind state, like stephysagria, lachesis, you have to give high potency. For example, P. Banerjee, he gives Conam 6C in almost every case of fibroid with very good results. So I would know that little bit more. Now the idea of ascending potency. This is ML Tyler's idea, and this was then taken by Dr. Sarkar, and he taught me. And the idea is where you, and especially in very bad pathologies, when you want quick results, you should give 1m, 10m, 50m. 1m 2 days, next day 10m 2 days, after that 2 days 50m. So like that 1m, 10m, 50m. Then wait for some time and let the whole kind of the remedy, let its entire deep action start, and you'll see very good results. But having said that, potency is of no use if the remedy is not right. So this is the bottom line. LM potency. I use LM potency also in some cases, and we use it quite a lot. And the way this using LM potency is something I learned from Dr. Sankaran. And the way he does it is what I learned, and the way I do it now is, so depending on the level. If the patient is at level 1, where only the name of the disease, then LM1. If there are only symptoms, then LM3 or LM4. If there are only emotions or level 3, so then LM5, LM6. If there are more general symptoms, then LM7, LM8. If there is the state of mind very, very clear, then LM9, LM10. And if it's a very, very high level of case, then LM11, LM12. And you can keep increasing the potency. A little bit more about experiences. Skin cases, generally, I don't like to repeat very often. I give one dose, wait and watch. Especially allergic skin cases, especially psoriasis. Children's cases, I have used 10m very nicely. There was a case, child's case, not getting better, and I was getting tuberculinum. So then I prescribed the remedy tuberculinum avis. I gave 1m and remarkable results after that. So sometimes high potency. I have a case of congenital heart disease, not improving by any other homeopath. He came to see me, the child. I gave Sanicula 1m. He had a very peculiar symptom, perspiration in the occiput while sleeping. Remarkable, now almost a year and a half, and he's able to live totally normally. Nosodes, medorinum, syphilinum, you have to give high potency. Animal remedies, tarantula, lachesis, high potency, 1m, 10m. Animal remedies and nosodes, high potency, few repetition. Acute cases. Now there are two ways of thinking in an acute case. One way of thinking in an acute case is the way we normally give 30 potency. But what I have majorly learned, and this is a little bit about, I've learned from Borland, and then I've learned in Kolkata. If the remedy is right, for example, you go to see a case of fever, very, very peculiarly, fever comes in midnight, there is a thirst, aggravation at midnight, all symptoms are of arsenic, you're sure, very peculiar. Then you can give high potency, sometimes 1m, I have even used 10m. 10m, one dose, wait and watch, and you see in 6 hours. Sometimes water remedy repetition. Administration of potency. Sometimes in emergency cases, like I see many cases of dengue, and especially in very bad cases of dengue, I could give high potency frequent repetitions. Like recently in dengue in Mumbai, I give China Rs very often. Sometimes I give China Rs 1m in, I put 4 pills in half a glass of water and tell them to take 1 spoon every 15 minutes. And remarkable change. So often high potency. In cases of coma, or when I am called to treat in hospitals to treat coma cases, cancer cases, patients who are not responding, then I give high potency, Carbovec 10m, opium 50m. You have to apply it on the wrist, on the ankle, on the forehead. Remarkable change. So be experimental, be creative, learn experiences from people. Don't be scared about potency and repetition. It depends on a lot upon your experiences also. So this presentation, thanks to my clinic team and Dr. Juhi Malhotra has helped me for this specifically, and always thanks to Alpesh and Pratik. They are my team. You can write to me. This is my email ID. This is my channel, and if you want me to consult for any case, you can write to me also. And yeah, this is about posology. It's a potency problem, but be creative, be innovative, apply, and you learn. Your experiences will teach you.